Good morning, students. Today I am going to start your next chapter. Topic is Principle and Significance of Professional Ethics as prescribed by Pharmacy Council of India, whatever the draft it is. So before I start your second chapter, hope all of you understood my first unit of your pharmaceutical jurisprudence. That is your first topic is pharmaceutical legislation. If you have any doubts, you can ask. So now I am sharing the presentation of your second unit. Hope you all can see my presentation. That is principle and significance of professional ethics. So introduction. Coming to introduction, pharmacy ethics is prescribed as per PCI. We are going to discuss. So actually what is PCI? PCI is nothing but Pharmacy Council of India. In earlier class also we have discussed PCI was established under the Act of Pharmacy Act in 1948. So Pharmacy Council of India is a statutory body of Government of India constituted under Section 3 of Pharmacy Act 1948, which was passed by the Parliament. In the pharmaceutical legislation we have studied. So the council was first constituted on 4th March 1948. The Pharmacy Council of India is constituted on 9th August 1949 under Section 3 by central government, and every 5 years it will be updated. The members, elected members, nominated members, and president. This will be changed, and the base of this Pharmacy Council of India is New Delhi. So that means the Pharmacy Council of India is the headquarter for all the pharmacy institutions and related to our profession. And every state has its own state pharmacy councils, and all the state pharmacy councils will be under Pharmacy Council of India. So the constitution of PCI is a constitution of 3 different types of members: elected members, nominated members, and ex officio members. Coming to the functions of PCI. So the PCI, to prescribe minimum standards of education required for qualifying as a pharmacist. To prescribe minimum standards of education required for qualifying as a pharmacist. So this PCI will give minimum education for qualifying as a pharmacist. So they started the courses, diploma, that is the minimum education in the pharmacy. Next, B Pharmacy, which is for 4 years. Next, PharmD, which is for 6 years. And in this continuation, you are also having PharmD PB. These students will be joining at 3rd year, 4th year, and 5th year. 4, 5, 6, 3 years they will be studying. Next, framing of education regulations. So PCI will frame the education regulations. These are called as ER regulations, ER 1991, ER 2008, ER like that. These are called as education regulations, prescribing the conditions to fulfill the institutions seeking the approval of the PCI for imparting the education in pharmacy. So all the pharmacy institutions will follow the PCI education regulations in delivering the syllabus. To ensure uniform implementation of the education standards throughout the country. See, for this point I can say very clearly, your PharmD syllabus all over India, all are studying same syllabus. So it is nothing but the educational standard throughout the country, and all the students are studying the same syllabus. Even M.Pharm also same syllabus. Now if you see B.Pharm is also same syllabus. So all over India, pharmacy students are studying, all the state people all over India, same syllabus, same curriculum. Inspection of pharmacy institutions seeking approval under Pharmacy Act to verify availability of the prescribed norms. So our inspection of pharmacy institutions. To say our college is also inspected by pharmacy inspectors whenever we apply for renewal. So this is function of PCI. So the other point is to approve the course of the study and examination of pharmacists, that is approval of the academic training institutions provided the pharmacy courses. So all these institutions, whoever is providing this pharmacy education and training, for them the course will be approved and the examination for them also will be seen by the PCI. We will be having examination authority. Each and every state will have its own examination authority. So our examination authority is JNTU. To withdraw approval if the course of the study or an approved examination does not continue to be in conformity with the educational standards prescribed by the PCI. To withdraw approval, if the approved course of the study or an approved exams does not continue to be in conformity with educational standards as per prescribed by PCI, so they can withdraw. Next is to approve qualifications granted outside the territories to which the Pharmacy Act extends, that is the approval of foreign qualification. So whoever is studied in outside or whoever is going outside from our place, so we will be giving like equivalency certificate that he is a pharmacist. And the last and important point is functions of PCI is to maintain central register of pharmacists. As we have discussed yesterday's class, that central pharmacy council will maintain the central register of pharmacists. So each and every state will have its own state pharmacy council register. From this, all the names in that one particular period, these names will be entered into central register. So these central register will be maintained by PCI. So it is one of the main function. So all these functions and duties of PCI comes under Pharmacy Act 1948. So all these functions and duties of PCI comes under Pharmacy Act means, see, for each and every point you can check in Pharmacy Act under some sections, like under section 10, section 12, section 15, all these points will be mentioned in Pharmacy Act 1948. Coming to your our topic, introduction to ethics, pharmaceutical ethics, that is our professional ethics. Ethics originate from a Greek word ethikos. It means customer or character. Ethics is defined as code of some moral principles. Moral is a branch of philosophy concerned with human conduct and character, moral. So as far as pharmaceutical ethics, the ethics in relation to pharmacy profession is called as pharmaceutical ethics. So the code of pharmaceutical ethics is formulated by Pharmacy Council of India, which are meant to guide the pharmacist as to how he should conduct himself or herself in relation to himself, his or her patents, owner of the pharmacy, general public, co-professionals, etc. and patients. So this is the code of pharmaceutical ethics that is formulated by Pharmacy Council of India, which is meant to guide the pharmacist as to how he has to conduct himself in relation to himself, his or her own pharmacy, or with the general public, or with co-professionals and patients. So profession of pharmacy is a noble profession as it is indirectly healing the persons to get well with the help of medical practitioners and other co-professionals. Right. Government has restricted the practice of pharmacy to only profession pharmacists, that is registered pharmacist under the Pharmacy Act 1948 can only see this. That's why government has restricted the practice of pharmacy to only profession pharmacists. That is those who are registered pharmacists, they have rights to dispense the medicines and they have rights to test the prescription. Unless who is not a pharmacy graduate, he cannot test the prescription. Next, PCA framed the following ethics for Indian pharmacists, which may be categorized under the following headings. So there are 4: pharmacist in relation to his job, pharmacist in relation to his trade, pharmacist in relation to medical profession, pharmacist in relation to his profession, pharmacy. So these are the 4 categories where PCI framed for Indian pharmacists. So first one is relation to his job. Scope of pharmaceutical services. This involves the supply of common required medicines without any delay from licensed persons, including at all hours in emergency. That is, emergency means it will be 24/7. So the pharmacy in relation to his job is a supply of common required medicines without any delay from the licensed. The point you have to see is licensed premises. So we will be following some system. So there every person will be maintaining his or own licenses. The appearance of the place should reflect the professional characters of pharmacy and indicate to the public that the practice of pharmacy is carried out in a well-established manner. That is appearance. If anybody comes and say, they have to say that the profession of pharmacy is very good in a systematic way they are following. So the appearance of the place should reflect the profession of our pharmacy. Next, conduct of pharmacist. Qualified pharmacist shall have personal control over the pharmacy. To say frankly, each and every pharmacy should be under a qualified pharmacist only. The conduct of pharmacist must be very careful so as to avoid any risk or error of accidental contamination in the preparation, dispensing and supply of medicine. So he should be very careful to see that the prescribed drugs are given and the preparation is also correct and the supply of medicine is also correct. There is no expiry and he has to be very cautious. So that is the code and conduct of our that is pharmacist. Pharmacist in relation to his job. Prescription. So coming to prescriptions, what is prescription? Prescription is a paper instructed by a medical practitioner to the pharmacist. I mean, he will be giving the prescription to the patient and patient will bring it to the pharmacist or near the pharmacy. Then the medicines will be dispensed. So prescriptions. When a prescription is presented for dispensing, it should be received by the pharmacist without any comment. So pharmacist should not comment and should not have discussion over it regarding the merits and demerits of its therapeutic efficiency. He should not show any psychogenomic expression. So some medicines will be there which by seeing that medicine name, he will be giving some different expressions or he will be looking at the patient. By seeing some medicines, he will laugh. So that is nothing but a pharmacist should be idle. He should not comment, he should not discuss about merits or demerits, he should not show any expression. And he should answer any question on the prescription to the customer with caution and care. He should not disclose any secrecy of the prescription to the customer. He should not disclose any secrecy of the prescription to the customer. He should not add or omit or substitute any content of prescription without the consent of the prescriber. That means whatever it is written in this prescription, the same medicine should be given by the pharmacist. Or if you want to add or omit or change or substitute, you should take consent of prescriber. In case of any error or doubt in the prescription, it should be referred back to the prescriber again. That is, if he has any doubt in this prescription, he has to consent back to the prescriber, whoever the medical practitioner may be. In such case, the customer should not feel doubt the efficacy of the prescription or it should not affect the reputation of the prescriber. At the time of dispensing the prescription, he should guide and advise the patient about the use of medicines as per the instructions of the prescriber. So he should guide the patient or advise the patient and the instructions as given by the prescriber to the patient. Pharmacist in relation to his job. Same continuation. Handling of drugs. Prescriptions should be carefully and correctly dispensed with the drugs of standard quality. All the ingredients shall be measured or weighed accurately. Poisonous substances shall be handled carefully to avoid contamination with other drugs. So handling of prescription should be very careful, and he should dispense the correct medicine with the standard quality. Because of one word or by reading or pronunciation, if there is a same word and there is a slight differences, if you have not observed carefully, then the problems will occur. Training apprentices. Senior pharmacist shall extend his full facilities to train pharmacists so as to make them a dependable pharmacist. So as to make them a dependable pharmacist. So the senior person will be there under him. The new fresh, those who have completed their pharmacy course and they are registered pharmacists, then they will be taking training under senior pharmacist. Next, good dispensing person, you can observe how they will dispense like this, by well organized, knowledgeable, trained, honest and communicative. Good dispensing practice, proper labeling. So the labeling should be very clear, like pharmacy name and address, drugstore about its details, doctor names, drugstore and phone number, prescription filled dates. So there are some proper labeling, it should be done properly. Next, pharmacist in relation to his trade. Pharmacist in relation to his trade. Here it comes first is price structure. Prices charged from the customers shall be fair and must be in accordance with the quality of the drugs, including his compounding charges. Quality of the drugs, including his compounding charges. Fair trade practice. Pharmacists should not go for cutthroat competition and unethical businesses by offering prices, gifts, or charge lower prices. He should not imitate labels, trademark, logos, signs, and symbols of others. If the prescription to be served by another pharmacist has been brought to him by mistake, he should refuse to accept it and should direct the customer to the right place. So the practice in trade should be very fair, and the pharmacist should not go in shortcut methods to get the business. Purchase of drugs. Drugs shall be purchased from the licensed, reputable sources only. So these drugs will be purchased from the wholesalers or retailers, those who are having licenses only. Hawking of drugs, that is forcibly thrusting of drugs, should not be encouraged. The pharmacist should not make attempts to get orders. So he should not forcefully do these things. Pharmacist in relation to his trade. Pharmacies and drugstores should not practice the method of self-serving or counter sales, as it may lead to self-medication. See, pharmacist can give OTC drugs, but he cannot give all the drugs without any prescription. That is, he should not make that such type of practices of self-medication. Advertising and displays. See, pharmacists should not display any material either on the premises or in the press or elsewhere regarding the sale of medicines or medical appliances to the public. Already you are having Drugs and Magic Remedies Act, under this objectionable advertisements, which we should not display or try to by through any of the modes, we should not advertise. Contraceptive preparations except bearing the word family planning requisites should not be displayed. The advertisement should not contain the following: a guarantee for therapeutic efficiency, no one can say that one; an offer to refund money paid. See, nowadays the goods sold once cannot be taken back, return, like that so many are writing, and this is in case of medicines, and you should not offer any refund money paid. An incentive scheme. there won't be any incentives for medicines. Recommendation of a particular medicine, medical practitioner or a hospital. No one should recommend any hospital or medical practitioner because they may thought in a different way. Pharmacist in relation to medical profession. Limitation to professional activity. A pharmacist under no circumstances take to medical practice, that is diagnosing diseases and prescribing remedies. However, in case of accidents and emergencies, he may render first aid to the victim. So limitation to the professional activity is nothing. A pharmacist should not take a medical practice, that is diagnosing diseases, because see, senior pharmacist may be there, but we may also become after some days an experienced person, but we are not having any chances to take a practice, and we cannot diagnose any diseases medicines, or we cannot prescribe any remedies. It should be done only with the medical practitioners. A pharmacist should not recommend a medical practitioner. Whenever any person feeling sick and he came near you and he asks, so you should not recommend any medical practitioner, but you can say, there is a general medicine, general MBBS doctor. If you have ear problem, there you are having a ear doctor. Like that, you can say only the department name. The doctors are available there, but you should not mention the particular doctor name. Clandestine arrangement. A pharmacist should not enter into any secret contract with a physician by offering him and any commission for recommending his drugstore to patients. See, nowadays, to say all so many people are doing in some places. See, they are going near that clinics and saying that, sir, I am my pharmacy is very near to your clinic, so I will be prescribing your medicines, whatever you are writing. So please refer my pharmacy name. So like that, this type of recommendation should not be done, and you should not offer any profits, or you should not give any commissions. Like that, you should not entertain any physician. Liaison with public. A pharmacist must always keep himself abreast with the modern developments in the pharmacy and other services. He should be in a position to advise physician on pharmaceutical matters and also be able to educate the people for maintaining healthy and sanitary conditions of living. Next, pharmacist in relation to profession. Regarding to the profession, the following code of ethics should be fulfilled. First one is professional vigilance. A pharmacist must be abide by the pharmaceutical laws, and he or she should see that other pharmacists are abide to that. That means all are strictly following the laws. Law-abiding citizens. The pharmacist should have a fair knowledge of the laws of the country pertaining to the food, drug, pharmacy, health, sanitation, etc. So you should be having fair knowledge. Relation with professional organizations. A pharmacist should be actively involved in professional organization and should be advance the cause of such organizations. Decorum and property. A pharmacist should not indulge in doing anything that goes against the decorum and property of the pharmacy profession. And last, pharmacist in relation to his profession is pharmacist oath. So all the pharmacy students while joining in the college or while living, they will be studying this pharmacy oath. That is a pharmacy oath. Thank you. See, if you have any doubts, you can